next is Senator Casey.
Mr. Chairman, thanks very much. In light of all the references to Ohio that Senator Brown made possible, I want to make sure we emphasize that Dr. Benton is now at the Children's Hospital of Philadelphia, so we're honored that she settled, at least most recently, in Pennsylvania. But Dr. Benton, I wanted to start with you and start with a critically important program that so many Americans know the name of, and so many Americans have a sense of what it does, but maybe none of us fully appreciate how important it is, and that's Medicaid. I've often said that Medicaid often tells us who we are as a nation, but maybe more importantly, tells us whom we value, whether it's children or people with disabilities, including children, older Americans who need skilled care in nursing homes paid for by Medicaid. We also know that Medicaid is the largest insurer for children, but it unfortunately pays significantly lower Medicaid rates and commercial rates, which has terrible consequences often for the pediatric health workforce and equitable access to care. I know in your testimony you highlighted how low reimbursement rates in mental health care access, the concerns that you have about that, particularly with regard to underserved communities. On page 7 of your testimony, you said, quote, better reimbursement for mental health services in Medicaid would make it possible to resource the full continuum of care our children and youth need, unquote. So the additional years to specialize in child psychiatry are not financially rewarded in the current payment structure with Medicaid, where a provider could earn more providing care to adults. So this makes it hard for a child-focused provider, particularly challenging for families covered by Medicaid. So how would aligning Medicaid reimbursement for children's mental health services with Medicare levels impact kids' access to care?
Well, thank you for that question, Senator Casey. So aligning those incentives would increase the reimbursement for Medicaid at a rate that would be more acceptable to most institutions. And that's key. Community mental health centers really struggle to meet the needs of young people based on reimbursement. Children's hospitals really struggle to meet the care for children with reimbursement. And in addition to that, lower pay for providers is discouraging for subspecialists, not only to serve the populations of young people, but to even train to serve the populations of young people. General psychiatry training takes 4 years. Child psychiatry training takes 6 years, 6 years of accumulated debt, which has resulted in mental health professionals opting out of payment structures for reimbursement for mental health care. And so increasing the Medicaid reimbursement rates to be on par with Medicare and medical rates would increase our opportunity to address the gaps in the continuum. So there are areas in the United States where there are no services on any continuum available to young people. Medicaid reimbursement would allow us to develop a full continuum of care, not just emergency and inpatient crisis services, but ambulatory services, home-based services, day hospitals, intensive outpatient programs where young people could be with their families and be at home getting the level of services that they need. And so the current Medicaid reimbursement rates impact all of those things, and increasing them to be better, which would be consistent with Medicare rates, would allow us to provide the services that we need and would allow us to encourage young people to pursue careers where they provided mental health care for young people.
Doctor, thanks very much. I might submit an additional question for the record for Dr. Benton, and I'll give back time, but I did want to thank again the panel for their testimony today. In particular, I wanted to thank Mr. Terrell for coming forward on behalf of his generation, and I hope there are other opportunities for us to engage. But thanks very much, Mr. Chairman.
Thank you, Senator Casey. Trace, you are now clearly the people's choice, because both Democrats and Republicans are praising you to the skies, and it is richly deserved.